afternoon, this is Renew Skin and Health Clinic. I'm here today with Dr. Jar to talk about mole removal. We're a private clinic based in Leamington Spa and we do a lot of aesthetic procedures and cosmetic procedures as well. So he's going to have a conversation about mole removal and the types of things that we need to know and the general public need to know as well. Thank you.
Thank you.
Hi Dr. Jar, can you tell us a little bit about moles?
Moles, it's quite a common problem. Everybody has a mole, and some moles are present since birth and some moles come on later in life, what we call acquired moles. But most moles, they come after the age of 20, so second decade onwards. And if we are exposed to sunlight a lot, or if we live in a hot climate or hot country where there's lots of sun exposure, we tend to get more moles. In general, white people tend to get more moles if they go to sun area and so on and so on.
And are there any moles that we should be worried about, and when do we know when to seek medical advice?
Yes, sure. In general, there is a general rule about the moles, what we call A, B, C, D, E. Now, A stands for asymmetry, which is if you cut these moles in the middle in any direction, the cut part should look identical. So it should be symmetrical, right? If you cut it from the middle in any plane, if they are not symmetrical, then this mole is suspicious and it can be a cancerous mole. So that's A. B stands for border. So how the border of the mole is. If the border is smooth and rounded, we should not be worried about. If the border is not smooth and rounded, if it's irregular, then we should be worried about. And then you have C. C stands for color. The color, normal mole or a benign mole, the color should be uniform, one color. If it's a red, it should be uniformly red. If it's a pink, it should be uniformly pink. And there should not be a different color in the same mole. Now, if there is a different color in the same mole, again, that mole qualifies an expert to look at and treat it because it sounds like a suspicious of cancer. Now, so different color types in a one mole should be considered suspicious, and that is C. And D is diameter. Diameter means the size of the mole. Roughly speaking, an end of a pencil is about 5 millimeter. If the mole is 5 to 6 millimeter size, we should not be worried about. If the mole is larger than 5 millimeter size, then obviously one should seek expert advice. And E stands for elevation. Is the elevation is again smooth and regular, or is it elevated in a different way all the way through in the mold? Now, if it's different pattern, then obviously one should seek expert advice.
Okay, and how do you remove these moles?
Well, the moles can be removed by classical surgery. If the mole is suspicious that it can be cancerous because it has got one of these features, what I was speaking to you about, then we take a normal healthy chunk of skin all around the mole and we send it for biopsy, and then defect, we can close the defect with the simple stitches. It can also be removed by radiosurgery or electrosurgery or shaving the mole and removing and cauterizing the area and so on.
And of all their methods, which would offer the best cosmetic results?
Well, when we're talking about the cosmetic result, and also the moles can also be removed by the laser, application of laser. Certain lasers, especially ablative laser, RBM and CO2, they can also get rid of the moles. But the minimum tissue extraction or minimum tissue extraction around the mole is the one which will cause minimum scarring, and of which of these lists, the radiosurgery or the laser or the classical surgery, I think personally that the radiosurgery is the best among all, which will give the best cosmetic result.
Okay, and can a sample be sent for biopsy after radiosurgery?
The answer is yes and no. If the mole is big enough, then part of the mole can be sent after radiosurgery for looking at under microscope. But if the mole is very small, then the answer is no, and then the classical method is the best method to send a biopsy.
Okay, that's lovely. Thank you for your time, Dr. Jan.
You're welcome.